Welcome back to the Medicinal Chemistry course presented by the Paracetamol Academy. We will be covering the drugs affecting adrenergic neurotransmission, Chapter 3 is the first part, and it will be presented by me, Carl Bouchara, a fourth-year pharmacy student. So we're going to start by covering a little bit of the background about the adrenergic system, followed by the biosynthesis, storage, release, reuptake, and metabolism of norepinephrine. And then the classification of the adrenergic drugs, the bulk of this chapter, followed by their structure-activity relationships, and then the exceptions to these structure-activity relationships. Adrenergic drugs influence the system in the body known as the sympathetic nervous system. In fact, in other texts, you might find that this system to be called adrenergic nervous system because of an early discovery that showed that the administration of adrenaline had similar effects to the effects that were produced by stimulation of the SNS. However, the true neurotransmitter of this system was eventually discovered to be norepinephrine. The effects of norepinephrine release are seen when norepinephrine binds to the effector cells. These are cells that carry receptors for norepinephrine. Generally, the various effects of the SNS are what is known as the flight or fight response. Moving on to the biosynthesis and storage. This process takes place at the adrenergic nerve terminal, whereby L-tyrosine, an amino acid, is actively pumped into the neuron cell. Then, the enzyme tyrosine hydroxylase oxidizes L-tyrosine to produce L-dopa, a name for dihydroxyphenylalanine. This process is the rate-limiting step. L-dopa decarboxylase, another enzyme, will then decarboxylate L-dopa to produce dopamine. At this stage, dopamine is then actively transported into the storage vesicles. We're going to talk about why that's important later. Beta-dopamine hydroxylase is the final enzyme in this process, as it introduces a hydroxyl group to generate norepinephrine. This part of the process occurs in the storage vesicle to prevent norepinephrine degradation by a circulating enzyme called monoamine oxidase, or MAO. The synthesis of epinephrine, as you can see, is mostly the same, with the additional step where the enzyme phenylethanolamine N-methyltransferase converts norepinephrine to produce epinephrine. Release of norepinephrine from the vesicles into the synapse is triggered by signal transduction. When a wave of depolarization reaches the nerve terminal, calcium channels are triggered to open, resulting in a calcium influx into the cell. This leads to the fusion of the storage vesicles with the cell membrane and the consequent release of norepinephrine molecules into the synapse. Thus, the release of norepinephrine is known as calcium-dependent release. Once released, the norepinephrine molecules reversibly bind to the adrenergic receptors. This can either happen on the postsynaptic neuron or on the presynaptic neuron. If it occurs presynaptically, the receptor it binds to, an alpha-2 receptor, stimulates negative feedback and so inhibits the further release of norepinephrine into the synapse. After the respective receptors have been stimulated, there must be mechanisms for the removal of norepinephrine from the synapse to terminate the adrenergic impulse. These mechanisms include uptake 1 and uptake 2. Uptake 1 is the process of transmitter recycling, whereby the norepinephrine in the synapse is actively transported back into the presynaptic neuron. Uptake 2 only occurs in the presence of high concentrations of norepinephrine. Norepinephrine that has not undergone uptake 1 diffuses out of the synapse and experiences extraneuronal degradation, which we will cover in the following slide. We already talked about how monoamine oxidase, or MAO, is an enzyme that metabolizes norepinephrine, and this can be seen in the pathways presented in the diagram. Another pathway is through the enzyme catechol O-methyltransferase, or COMT. COMT enzyme binds to substrate to the catechol functional group. They are found extensively in the gut, which may decrease the oral bioavailability of drugs with that functional group. Other enzymes involved in the process include aldehyde dehydrogenase, denoted as AD in the diagram, and aldehyde reductase, denoted as AR. All of the compounds, aside from norepinephrine in the diagram, are inactive, meaning they do not elicit any kind of response. The adrenergic receptors were classified according to their response to different adrenergic receptors, stimulants. These are norepinephrine, epinephrine, and isoproterenol. Alpha receptors respond best to epinephrine, followed by norepinephrine, followed by isoproterenol. So epinephrine and norepinephrine have a much greater affinity to the alpha receptor than isoproterenol. Relevant subclasses include alpha-1 and alpha-2 receptors. Beta receptors have the greatest response to isoproterenol, followed by epinephrine, and a decreased response to norepinephrine. The relevant subclasses include beta-1 and beta-2, and to a lower extent beta-3 because they are still being investigated. As we can see in the following table, different organs in the body have different major adrenergic receptors, which elicit different responses. For example, when the alpha receptors in the vascular smooth muscle cells are stimulated, they lead to vasoconstriction, whereas the beta-2 receptors on the vascular muscles lead to dilation. Or, when the beta-1 cells of the heart are stimulated, they would lead to increased heart rate and increased heart contractility. Classification of adrenergic drugs follows two categories. One is whether they mimic the effects of SNS stimulation and are so-called sympathomimetic agents or agonists, and the other is whether they inhibit SNS stimulation and are so-called sympatholytic agents or antagonists. The other classification describes their interaction with the receptors. If the agents are directly acting, they have affinity for and thus interact with the corresponding receptors. Indirectly acting agents have no affinity for the receptors and thus work by influencing the release, metabolism, or other kinetic factors of norepinephrine. Mixed acting agents, as the name implies, have both directly and indirectly acting properties, and therefore interact with the receptors and at the same time influence the kinetic factors of norepinephrine. This table shows the various therapeutic uses of agonists and antagonists. For example, if a patient presents with tachycardia, which is a faster heart rate, we can administer beta receptor antagonists as a means of pharmacotherapy. These beta antagonists would decrease stimulation to the heart and thus slow down the heart rate of the patient. To ensure directly acting agonistic activity, the following criteria should be met. First, the primary or secondary aliphatic amine must be separated from the benzene ring by a chain of 2 carbons. In addition, the C1 of the 2-chain carbon has to bear a hydroxyl group in the R configuration. Because of the basic amino groups, agents derived from this structure are all ionized or positively charged at physiological pH. I know this table looks intimidating, but all it's doing is just displaying different kinds of substitutions on the groups denoted as R1, R2, and R3. With these various substitutions, different receptor affinities are indicated. So now we are going to cover how different substitutions may lead to their corresponding receptor affinities. Now let's take a look at how R1 substitutions influence the activity of these molecules. In the following example, as the R1 group changes from a hydrogen group in norepinephrine to the methyl group in epinephrine, beta activity becomes greater than alpha activity. If we increase the R1 size further to an isopropyl group that can be found in isoproterenol, we see non-selective beta agonist activity and no alpha activity. Thus, we can conclude that as the R1 group increases in size, as does the beta activity, with a concurrent decrease in its alpha activity. Now, a further increase in a size to a T-butyl group as seen in culturol increases the beta-2 agonistic selective activity of the molecule. This could be useful if we need a molecule with bronchodilator properties. Non-selective beta agonists like isoproterenol, as we have seen, does cause bronchodilation. This would also lead to undesirable cardiac effects. Thus, selective beta-2 agonists could be beneficial. Now, as you can see, cholesterol has a catechol moiety, making it subject to COMT metabolism. A way to avoid COMT metabolism is to administer this drug as a prodrug. Butalterol, a biotoluester, is a very lipophilic drug and administered by inhalation. In the lungs, it is hydrolyzed by esterase to produce cholesterol. Using this prodrug doubles the duration of action of cholesterol because it bypasses COMT metabolism. Let's move on to substitutions at R2. If there is a methyl or ethyl substitution at this position, this allows the molecule to be more resistant to metabolism by MAO due to increased bulkiness, but has no effect on metabolism by COMT, as they are main substrates of the enzyme. A substitution at this group introduces another asymmetric center, leading to diastereomers, which have variable biological and chemical properties. For example, a substitution of a methyl group leading to alpha-methyl norepinephrine has two conformations. The 1R2S conformation allows for direct agonist activity with affinity to alpha-2 being greater than alpha-1. However, in the 1R2R conformation, the molecule loses its affinity to the receptor and becomes indirectly acting. The addition of an ethyl group leads to ethyl norepinephrine, and it has greatly reduced alpha activity, and the molecule becomes more selective for beta agonistic activity. With regards to aromatic ring substitutions, at least one hydroxyl group is needed for bonding with the receptor. However, if there is only a 3' OH, activity is selective to alpha-1 with almost eliminated beta activities. Examples include phenylephrine and metaraminol. With their lack of R1 group bulkiness, this further limits to their beta-selective activity. An example where there is no OH group, but a methoxy group to allow for hydrogen bonding is methoxamine, another molecule selective to alpha-1. So far, phenylephrine, metaraminol, and methoxamine are all not substrates for COMT. Thus, their duration of action is going to be longer than epinephrine. Again, since the 3', 4' dihydroxy substituted benzene ring is a substrate for COMT, changing the substitution to a 3', 5' dihydroxy group will prevent metabolism by COMT, and thus make the molecule be orally active and have a longer duration of action. An example of this can be seen in metaproterenol and terbutylene. Additionally, we can infer that from the bulky group substitution at R1 that this molecule is beta-2 selective. Other examples of orally active molecules include albuterol and pyrbuterol because of their COMT resistance since they do not have a catechol group. In addition, with their bulky R1 groups, we can also infer that they are beta-2 selective agonists. Finally, the same can be said for salmeterol. It is not a COMT substrate because it does not have a catechol moiety, and we can infer that it is selective to beta-2 receptors because of its large, bulky R1 group. Not all directly acting adrenergic agents have an aliphatic carboxyl group. Although dopamine is not strictly an adrenergic drug, it is a catechol amine with cardiovascular effects due to SNS stimulation. Firstly, it dilates blood vessels in the kidney through dopaminergic agonistic activity. At higher doses, it stimulates the cardiac beta-1 receptors both directly and indirectly, stimulating the cardiovascular effects that we talked about earlier. If the dose is increased even further, alpha-1 activity is observed. However, dopamine is still a catechol and is thus subject to COMT and is not orally active. In addition, it is also subject to MAO degradation. Another example, as an exception to the SAR, is the catechol dobutamine. Its chiral center allows for a levo and dextro configuration, where the levo configuration has alpha agonistic and beta-1 agonistic activity, while the dextro configuration has alpha antagonistic and beta-1 agonistic activity. Both enantiomers have very little beta-2 activity. Thus, when given as a racemic mixture, whereby both the levo and the dextro are given together, the alpha activities of the two enantiomers cancel each other out, leaving primarily the beta-1 agonistic activity. If you guys would like more information, please feel free to check out the reference of this textbook. And thank you guys for tuning in. I hope you understood the points I made in my lecture and enjoyed it. If you have any questions, please feel free to leave a comment and I will make sure to get back to you. And stay posted for part 2 and part 3 of this chapter. Thank you again.